Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, welcome to the Hair Loss Show. My name is Dr. Vikram Jayaprakash and welcome to episode number 42. And we're going to go through some Q&A again today. We did a Q&A session on Finasteride and that we had a great response to that. So we thought we'd do a part 2 session with that and answer some of the most frequently asked questions that we haven't covered before, specifically on Finasteride. Again, thanks very much for watching the show. Hopefully you're enjoying the content. Again, hopefully you're keeping safe during this time. Please do keep safe, practice good hygiene and good social distancing, and we'll see you all again on the other side of this. But in the meantime, let's crack on with some Finasteride Q&A. So question number 1, can you take a break from Finasteride? And the answer is yes. So sometimes I do recommend to patients that they take a break from Finasteride for a number of different reasons. First of all, if they are looking to have children, then I generally say, look, stop taking the Finasteride 2 or 3 weeks before you're going to start trying for a baby. As soon as your partner falls pregnant, you can go back on the Finasteride. And even if you're off it for 3, 4, 5, maybe even 6 months, for most men, they're not going to lose a lot of ground. But generally, I think it's safe if you're not taking Finasteride during that time when you're trying to conceive. So absolutely recommend a break during that, in that specific scenario. Other scenarios, if someone's getting side effects, so for example, I may have a patient who's been on Finasteride for many years, and then slowly there's a buildup of Finasteride in the system, and at some point someone comes and say, hey, look, I'm starting to notice a little bit of some side effects. My libido's not as good as it used to be. In that scenario, I say, great, let's stop taking the Finasteride, let it wash out of the system. It probably only needs to take 2 or 3 weeks, and then either I will restart at the same dose or slowly build up on the dose. But again, if you're off your Finasteride for a few weeks or a couple of months, you're not going to lose a lot of ground. And that's probably the key point to make here, that if you are off the Finasteride, you're not going to suddenly lose a lot of hair. That said, if you are on Finasteride, so if you're losing hair and you start taking Finasteride and you are able to halt that process, so you stabilize the hair loss for months, years, and then you choose to come off the Finasteride, what will probably happen, what we've seen, is that you will slowly regress. Now, where is the end point of that regression? Probably to where you were going to be anyway if you hadn't been taking the Finasteride in the first place. So a prolonged break will probably be detrimental, and you'll lose the ground that you had sort of made in the period when you were on it. But for short periods of time, no problem. All right. Second question. Oh, that's a good one. Which is better, Finasteride or Dutasteride? So real quick, we've gone through this a number of times. Testosterone converted into dihydrotestosterone, and traditionally what I say is that there's an enzyme called the 5-alpha reductase enzyme that causes that conversion. That's only half the story. The reality is there is a type 1 of the enzyme and there's a type 2. And for most people, type 2 is probably the more active. So most men that are losing hair because of androgenetic alopecia, they have type 2 activity. And if you've got type 2 activity, Finasteride is very, very good at blocking that. But there are individuals who have quite a significant amount of type 1 activity that causes hair loss. And for example, I may have someone who is losing hair. I start them on Finasteride and they've been on Finasteride for a few months, but they're still losing hair. In that individual, I'd probably suspect, oh look, maybe there's a bit of type 2, but there's also probably type 1 activity as well. And in that scenario, if you've got someone that you suspect has predominantly type 1, then Dutasteride is very good because dutasteride will block type 1 and type 2 as well. So the obvious question then is, well, if you've got dutasteride and it blocks both type 1 and type 2, isn't that better? Because then you're covering all your bases. And the reality is probably, I can see the argument there, but it's not something that I do regularly in my practice, because if you are someone that's going to block both versions of the enzyme, you're more likely to get side effects in that scenario. So I generally like to use finasteride and then add on dutasteride if I need to on a small dose to get that extra type 1 blockade. So it's not a simple question as in, which is better, type 1 or type 2, which is better, finasteride or dutasteride. It is which one is more appropriate at that time. So I hope that clears up that issue there. Next question, what if you don't want to take finasteride? There's a lot of, if you go online, a lot of people are talking about finasteride, a lot of commentary about side effects of finasteride, and it can be quite overwhelming and scary as well. So I see that, I get that. That's generally not our experience. I think Russell would say the same if he was here. But everyone has to try it and see for themselves. But of course, if you don't want to take finasteride, that's perfectly fine. Understand where you're at, and if you make an informed decision, that's absolutely perfect. You have multiple options for you if you don't want to take finasteride. You can maybe look at the topical version of that and get that specifically compounded. We've done a video on topical finasteride, so make sure you refer to that, because that may be an option. It has a much lower side effect profile than the oral version. Or you could neglect blockade therapy altogether and focus on stimulation therapy with minoxidil or low-level laser therapy or platelet-rich plasma. These are options as well. So it's not finasteride or bust. There are other agents that you can use, or there are other versions of the finasteride that you can use as well. Good. Last question, how long will it take to see the results? This is a really important one, because a lot of people, or some of the comments that I get, a lot of people go, I've started taking finasteride, I've been on it for a couple of months, I'm really not seeing the result. So the first thing is you've got to clarify what your expectation is. What are the results that we're looking for? Male pattern hair loss is a progressive condition, meaning that if you don't do anything about it today, it is likely that this time in 12 months' time, the hair loss is going to get worse. You're going to have more balding in a particular area. So the goal of medical therapy, be it stimulation or in this case blocker therapy with finasteride, is to stabilize this condition. All right. So if you're on finasteride and you don't experience any further hair loss, then that is an absolute win and an absolute victory from that perspective. But I counsel patients that you shouldn't expect to see that for at least 6 months. So when you start on therapy, it's not that you're going to see the results, you're going to see stability straight away. You may see a little bit of loss, but it's started to work immediately, but you may see some continued loss because of the hair cycle and the nature of the hair cycle. But you have to give it 6 months to see how have things progressed, because whatever you may shed initially will come back on the next hair cycle, which is in 3 months' time. So a 6-month period is a good period at which to judge the efficacy or how effective that therapy actually is. So I get people going, I've been on it for 2 or 3 months, not sure how effective it is. I'm always saying, listen, come back at the 6-month period, because that's when you can judge how effective it actually is. All right. And that's probably the end of today's Q&A. I hope you found that useful. please keep the questions coming in, and we'll get to another Q&A again soon, because I think that sort of has been received quite well, and that adds lots of value because we're answering the questions that you want specifically. Once again, thanks very much for watching. Please subscribe to the channel and give us a like as well, and we'll see you on the next episode. Thanks very much.